incontinence, I would shy away from mentioning any of that or speaking or elaborating because I am a gynecologist, but definitely it's not exclusive to the female population.
So some people will say, yeah, I've got a weak bladder.
Sure.
Would that be construed as incontinence?
So that's a very interesting question. It's part of the spectrum of disease, but incontinence by definition is actually wetting yourself.
Right.
The weak bladder is a patient who may just have that urgency and irritation. So my bladder falls, I need to rush to the toilet, but I get there in time. I don't often have episodes of wetting myself. They fall under the spectrum of the overactive bladder. So basically, a bladder that's not quite listening to what your brain's telling it to do on time. So you're constantly rushing off to the toilet. There's many visits to the toilet and you have to get there quickly. But these patients don't necessarily wet themselves.
My studio guest tonight is specialist obstetrician and gynecologist, Dr. Kasandri Govender, and we're talking about incontinence and prolapse, just touching on the subject of prolapse and not suffer with incontinence.
Absolutely. So when you're looking at prolapse, it's very simply, if I can just put you in the picture, if you're looking at your pelvic floor and you're looking at the organs there, you're looking at your bladder, your uterus, and your rectum. Right. So you're looking at urination, the reproductive organs, and defecation. And how I like to think about it is your pelvic floor is a basket that holds all these organs up. For any number of reasons related to age, connective tissue disease, weakness, or as a result of surgery, this basket can become weakened. And what happens is these organs can now descend from their normal point of position lower on. And how this patient would present with, she may actually feel a lump in her vagina. She may have a dragging sensation in her pelvis. She may have urinary symptoms, defecatory issues, and lower back ache. And more often than not, it's this discomfort that causes a patient to go to the doctor. So when these organs descend abnormally or the pelvic floor weakens, this can cause a range of symptoms.
Is it fairly common, Dr. Govender?
If you look at it, 1 in 10 women will suffer from prolapse at some point in their lives.
10%?
Yes. Just to note, those are international statistics,
yeah.
And there is a paucity of data for our South African population, but I know that that's being worked on through research already.
So, I did tell you I had to do a bit of reading over the weekend.
Sure.
And I came across this article from the National Institute of Health, where they said that they did a massive study which revealed that the frequency of pelvic floor disorders increased with age, affecting more than 40% of women aged from 60 to 79.
Yes, I agree.
And about 50% of women 80 years and older.
Yes.
And they say that pelvic organ prolapse results when pelvic organs such as the uterus, bladder, bowel collapse into the vagina. So that's how they've defined. So, their numbers from 60 years upwards. So would that be common in South Africa?
Yes, it is. The incidence worsens with increasing age, and that's really related to a loss of elasticity with your muscles, with your tendons. It's a lack of estrogen. So it's really just a combination of these factors that result in an increasing incidence the older we get.
All right. So what would be some of the risk factors for a woman presenting with a prolapse?
So anybody over the age of 40.
So age plays a big role.
Age plays a big role. Okay. Childbearing and the actual details around that. For instance, a female who's had a baby over 4 kgs is at greater risk. A patient or a lady who has had prolonged or difficult vaginal delivery is at increased risk for prolapse.
And that's because of the stretching and the baby coming through the birth canal.
Absolutely. Okay. A patient who has had a forceps delivery is at increased risk as well because of possible damage to the neural supply and to the muscles making up your pelvic floor. And then other things such as connective tissue diseases that may affect your neural pathways or affect your connective tissue, scleroderma, sclerosis, Parkinson's, anything along that line. And then there is a subset of factors like idiopathic, where we can't really explain it, but it happens.